Live. I am live on Instagram, I think. I'm hoping the audio is working. Should I put a thing saying, is the audio working? Is the audio working? I hope the audio's working. I hope you can hear me. Hope you can hear me. Voice. So I hope the audio's working. Yes. Oh God, this is the. I put it this way round. Does it? Should I do it this way round, or the? What? Is there a protocol for which way round? I thought I'd do it this way, and I thought this looks more professional because it looks like a computer, doesn't it? This way round, but I can't read the comments because I've got to go like that. Anyway, you know what? I'm going to go like that because otherwise this is going to. Oh. Right, I think I'm doing this on the normal Instagram, so I'm not sure if there's a time limit. Where's the thing? There it is. I can wave at people. I'm going to wave at everyone. Guaranteed wave if you join this. Yeah, that's no good because you'll have joined already to have seen that. Anyway, right, I'm trying this out. Usually do this on Facebook, but I'm not welcome on Facebook at the moment. Temporary problem. Nothing that we can't sort out. And we are in the process of sorting out with Facebook, and I'll be back in, well, we're not actually, I'm just waiting for them to lift the ban 3 more weeks. So I've got some questions here, and I'm looking forward to some questions because there's people here, I think, or yes, there is, well, I know there is because I can see. So if you've got a question, anyone, just post it and I'll answer it if I can. Plastic surgery is the topic. / cosmetic surgery, by the way. I don't know if I should have made that clear, but Sarah Jane sent a request to be in your live video. Yes. How do I do that? Yes. Done that. Anyone can show someone. Let's do it. I don't know. This is a new format for me. I'm clicking the buttons. I'm just clicking anything that comes up. Oh, look at that. Look at that. Split screen. Look at that. Oh my God. Look at that. Are you, can you hear me?
I can.
We're together. Is this a live question coming in? Have we got a live question? Have you got a question?
I've got to think of one.
Oh, for the love of God, you've asked to join. Oh,
okay.
You are lucky. We're lucky at the early stages of this. Otherwise, we would insist on questions to be ready before asking you to join. But that's the first time anyone's ever joined. So thanks for joining.
This is the first time I've watched live, and it just
says,
yeah.
What did it say? Did it say, do you want to join?
It says yes, and I just clicked something. So
that's embarrassing, isn't it? Well, do you want to come? I've got some questions here. You see, I've got some questions that people have already asked me, which I can go through. I can X you now and let you go, and you can just do what? No, I'm just pressing. I'm just waving at people. But that's great. So when you join, does it say I should join someone else's live thing? So anyone can just click to join coming up. Right. Well, lovely to have you on board. Nice to see you. And thanks. If you've got any questions, just let me know. Just after joining, I'll let you join again anytime.
I will. All right,
Thank you. Can you get yourself off actually?
Yeah, I'm
or do I have to?
Myself off.
Bye. All right then. Bye. Oh my. I'm removing. That sounds bad. Oh my God. I mean that is something, isn't it? That is something. God, I gotta calm down after that. Right. If anyone wants to join, ask a question live, they can do that. Opening myself up a bit there, aren't I? So right. So I've got some questions here. If you've got any questions, you can either join live or you can just ask it, I guess. I guess you can write a comment. So, number one question. Mole stroke cyst affect... Will a mole stroke cyst affect beard growth? So we got a chat with a mole or a cyst. I think it's a mole in his beard. Got this area. Oh. And it is, yes, is the answer. So when you have same with the hair. if you have a mole or a cyst or if you create a scar, so if you cut something out and make a scar, so if you cut a mole or a cyst out, you get a scar. So you don't have any hair on the scar. Scar alopecia, it's known as. So when the scars don't have hair on them, so it is a problem in hairy areas. It's a problem in not very hairy. Oh my God, we've got a question here. How am I going to keep that? Can I scroll the? Oh yes, I can. So it's the problem in a not very hairy area. It's in a very hairy area. We have a scar. If you had like long hair, you just cover the scar. It doesn't matter. In a non-hairy area, then you have a scar and it sort of like fades, and usually it's not too bad. The problem, it's actually worse in a trimmed hairy area. God, it's a tongue twister. So if you've got your beard, if your beard's quite long, your scar might cover it if the hair covers it. But if you keep your beard trimmed, or if you're balding, if you've sort of not got much hair and you sort of make your hair nice and short, a scar is more obvious. So a scar is more obvious in shorter hair. So stuff like a beard or a man with, you know, like a crew cut, the scar will be more obvious because you see a line in the scar if it's like cut short. When this hair is longer, it's less obvious. And actually when there's bald, if it's clean shaven, the actual scar will be less obvious than if you had some stubble. So yes, good question that. So a scar on a hairy area has got no hair on it, and so that's something to consider. Good question. Well, now we had a question live somewhere here. Here we go. Sam, do you shave excisions on fibrous Oh, just someone else asked a question. I've just got to write that down. Sorry. Do you do shave excisions on fibrous papules of the nose, even if they are flat and only slightly raised? Good one, Sam. Really hard. Yes, you can. But shave excisions are easier to do the more raised it is. So if it's a big raised thing, you have to get like down at the base of the mountain. And if it's a big lump, you can get the base of the mountain quite easily. If it's not very raised, so sometimes if you do a shave excision and there's a little bit left behind, or if you've got like a little, like you're describing, a fat fibrous papule or some benign lesion which isn't very raised, it's actually more difficult to do a shave excision. Because if you can imagine it from sort of our point of view, we've got this scalpel and we're trying to get this scalpel flush. If it's not very raised, you keep on going over the top of the mountain. You keep on skirting over the top of the mountain. You're trying to get the base of the mountain. And if it's a mountain like boom, 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 you're going to get the base easily. You're going to cut the base off. But if it's a little hillock, if it's just a hillock, your knife's going to skirt over the top of the hillock. And so it's actually more difficult. So if you are actually trying to get the hillock, there's a tendency to make your knife go down a bit to get purchase on the hillock. But you've got to be careful, because all the problems with a shave excision are over or under correction. Those are the sort of two bad things that can happen. So over correction means you get a dent. So that's why you want to get it flush. But if you're angling your blade down in order to get purchase, to get started with your shave excision, you've got to be careful you don't get a scoop. So there's a risk of getting more of a dent with a less raised thing. So you have to sort of angle it down just to get purchase, and then try and flatten it off and try not to get a dent. But it is actually more difficult. A shave excision is more difficult on a less raised thing. And obviously on a flat thing, you can't do it at all. But if it's a little bit raised, you can have a go at it, but it's tendency to keep on skirting over the top of it. And then you think, oh, I'm going to get this off, and you angle it down, and then you get a dent. So that's the risk with shave excisions. You do over or under correction. So that's an over correction. Under correction, obviously, leaves a bump. So that is a good question by Sam Brown. I think it's Sam Brown. Is it? Oh, should I not say names? Let's keep it anonymous. By someone. Sorry. But it was on the thing. So I don't do names when you ask questions. Bit flummoxed with this because this is a new format for me, and I've just done a live interaction with a human being. Thank you. Might come and see yourself so you can see it. That's the ticket. Probably wouldn't be me, Sam. I'm not really seeing new patients anymore. I'm running the clinic, so it is other people. I've got other surgeons there, but we've got two very good plastic surgeons there, not here at the clinic. Whew. So yeah, new scenery. It is new scenery. It is, well, it's not new scenery, is it? I've done it here before. I'm in my house. If 3 or 4 moles removed and small skin tags, I've taken this off the email and I've just written it in my own writing, which I'm struggling to read. Query charge. That's right. I'm not sure if that was supposed to be a question for this, but anyway. So if this, I think this person's got several moles, and yeah, it's often the way that people got skin tags and things. So just say, if you're having it's actually a good question. If you're having a procedure done and you've got some skin tags, because it's easy just to snip them. So actually, whatever you're having, whether you have moles or you're having something else done, I've done surgery like breast augmentations or tummy tucks, something like that. People got a little skin tag, they're a bit afraid to ask. They come back for the dressing a week post-op and say, oh, what about that skin tag? You know, well, if you said at the time, I'd have just snipped it, because the skin tag doesn't need to be sent for histology. If it needs to be sent for histology, like looking under a microscope, then there's a charge associated with that. But if you're having surgery for other stuff, whether it be other moles, or even if you're having, as I say, a tummy tuck or a breast or whatever, any sort of surgery, and you've got a little annoying skin tag, it's quite easy to just snip it at the time. So just say before, and most surgeons, I think, would just say, yeah, fine, we'll just snip that for you, no problem at all, because they're very easy to do, especially if you're having a general anaesthetics, then it's even easier. Do you consider adding non-invasive treatments at your clinic? Yes. Oh, yes. Yes, we do. Yes, we do. We've been considering it for ages. We're still considering it. And it's a real problem, because it's not a problem, it's just finding the right one, and they're really expensive, and it's difficult, because one day we might get one and then you'll say, oh, you said that, you know, I don't want to say bad things about them, but the results are subtle. The problem is they're expensive and the results are subtle. This is what I've found so far. By non-invasive treatments, I guess you mean things like the fat freezing and the skin tightening and what have you, things like that. So in my experience, they're expensive and the results are subtle. Having said that, there's a huge market for them. So I think there is an element to say that perhaps we should offer it, but I'm a bit concerned, because the whole premise of the clinic is that we want to give everyone a fantastic result. And if we can't give a fantastic result, to be honest with you, rather not do the surgery. If it's, you know, maybe not going to give you a great result, then we'll say, look, you know, rather not do it. And so we try and make everybody have a fantastic result. And I think you've got a better chance of that, let's just say, with surgery. You can never guarantee it with surgery, but you've got a better chance of it. You know, it's rare that someone comes back and says, oh, I can't see a difference. Did you look at, oh, yes, you showed Vicky, didn't you? So anyway, sorry. I'm getting distracted by the comments. It's rare with surgery that you can say, look, you know, look at the difference. Surgery is usually pretty obvious. With the non-invasive stuff, I think it's a bit more subtle, and it's expensive. That's the problem. So it's getting the balance right. And yes, I think you did show Vicky that one, and skin tightening. Yes, it would help with the recovery of the surgery, and we could use it as an adjunct to surgery. And yes, we should. I think it does help. I think it does help, and I think it does work, and it must obviously work. Otherwise, there'll be a huge industry in it. And you know, maybe we're just slow to pick it up. But maybe I'm expecting too much of it as a surgeon, because at the end of the day, anti-wrinkle cream sells in, you know, anti-aging cream sells, and people don't say, look, that's not made me, I'm still aged. You know, people don't complain about aging when they buy anti-aging cream at vast expense. So maybe people would accept subtle results because it's not surgery. The problem is, as I say, when it's quite expensive, I worry that people would then get cheesed off if you do an expensive thing to them and they get a subtle result. But I guess it's all about saying to people, look, this is subtle and it's expensive. Do you still want to go ahead? You know, patient selection. So maybe we should to look at that. So yeah. So we are still looking, and we have looked at a few, and we continue to look at a few, and yeah, a late adopter on that. Whew, what? Oh yeah, why? Oh, God. Why something tattoo ankle or ring finger? I know the gist of the question. The gist of the question, because I know that what happens is we get photos of tattoos in, and I think this is actually coming from Nicola. I think probably is coming from people who work in the clinic, because what happens is we get people who send in photos of tattoos, and they show it to us, and we say whether we think it can be removed or not and how many sessions. And I think sometimes the people at the clinic, like Nicola and Sally, and the people who are answering the calls and taking the calls, are a bit surprised when we say, I had one the other day with a lady with a tattoo on the ankle, and I think I said it would take 3 or 4 goes, and she's like, wow, it's a really small tattoo. Why have you said that'll take 4 goes? Whereas, one on the tummy, you say take 2 goes, or one, or, just do it in 1 go, and it's massive. So the reason, what you've got to think about is the laxity of the skin. I mean, this was at the ankle right by the bone, behind the bone of the ankle. So it was really tight. The skin is really tight in that area. And if you can envisage yourself, the skin, there's not much laxity, number one, and number two, the movement. The movement of the ankle is going to put that skin under tension. So there's going to be a risk that wound will well open up. So we'll be very careful about taking skin off. Same with the hand. We get these ones on the ring finger. Often people, with tattoos on the ring finger, really small tattoos. We say it's going to take 2 goes or 3 goes, tiny little tattoos. But there's not much spare skin there, number one. And also the movement is going to risk the wound opening up. So you've got to be careful not to put it under too much tension. So it is a balance between the size of the tattoo versus the laxity of the skin in the area. So like the tummy, you can take a huge bit of skin off and stitch it up. So you could potentially get a huge tattoo off in 1 go, whereas the hand, the shoulders are classic. The shoulder's quite tight skin. It's not very, and it doesn't scar very well. So, these people with big tattoos on the shoulder, often it's a no-no. Even a small tattoo on the shoulder, I'd worry about it creating bad scarring. But yeah, the finger is a classic, that you cannot get much skin out. And when you do try and cut skin out of the finger, you often get like a shark bite. You get a dent because the skin is so tight, because you're taking some skin off the cylinder of the skin. And do you see what I mean by the finger being a cylinder? So yeah, fingers are difficult and ankles difficult. Tattoos, why excision rather than laser? Well, I would say, to be honest with you, the first line of tattoo removal is laser. To be honest, and I always tell people that, look, try laser first, because when laser works, it's really good. There's obviously no scarring, and it's it can be really good. So I usually say to people, actually, laser is the first line treatment for tattoos. We really see people, we don't do laser at the clinic, we only do excision. So we only really see people once they've had laser, tried laser, or there's a reason they might not want to try laser. So, but if, the advice I would give is try laser first. The problems with laser is that sometimes it can struggle, and sometimes it can make a blurred version of the original tattoo, and it can particularly struggle with colors, with the pigment. When the pigments come, so you often see that it's got rid of the black, but there's still the pigment areas. So you could always do laser first, and then have the bits excised if there are pigment areas that the laser can't cope with. But as a general rule, I would say to you, laser is first line. But laser can be painful, and laser can take multiple goes. But having said that, excision can be painful, and maybe this can take multiple goes sometimes. So it's no right or wrong, but I do think that laser is probably the first line. But if it doesn't work, or if you need it quick, some people say, I'm, joining the army. Well, actually, the army probably don't mind about tattoos, do they? Maybe they do. I don't know. Do the army join? Okay, I've got a job in an office or something, and I'm not allowed a tattoo or something. So if they want it done, boom, there, obviously excision will get rid of it if we can excise it. A couple of years ago, I had breast implants. Not me. This is the question. And I've got a breast lump. Should I be concerned? Yes, you should. We have that last week? But none of you guys were there last week, probably, because it was on YouTube Live last week, wasn't it? Different platforms every week. Back on Facebook Live when I'm allowed back on Facebook, which is in about 3 weeks, I think. But yes, you should be worried about a breast lump, period. Whether you had implants last week, last month, 3 years ago, or you haven't had implants at all, you should be worried about breast lump. So get it checked out. Exhibit A, go to your GP, get it checked out. If you've got breast implants in, it's not unreasonable for your doctor to maybe want to see your plastic surgeon. So we would see you no problem at all, because it might be the implant that's causing the lump. It might be a knuckle of the implant. Just as time, got an implant there somewhere, but as time contracts around the implant, it can make a little knuckle of the implant. You can feel a little edge of the implant. So it might be that, in which case that's fine. Or it might be within the breast tissue, which is sort of anterior in front of the implant. Whether the implant's in front or behind the muscle, the implant is always behind the breast tissue. There's no breast tissue behind the implant, so implants don't really hide lumps. So the lumps of the, or at least lumps in the breast. So you will still be able to feel your breast. So we might be able to tell whether it's implant or breast. But if we're not sure, or particularly if it's breast, if it feels like there are lumps in your breast, then you should get it checked out by a breast surgeon. I did talk about this last week, I remember now, because breast surgeons are general surgeons who do more of the cancer work with lumps and what have you. If you have a lump in your breast, you wouldn't come and see someone like me. Although I pretty much only do breast, I'm a plastic surgeon, so I do the reconstruction after cancer and cosmetic breast surgery like implants and lifts, but I don't do lumps and I don't do cancer work and ultrasounds and MRIs and things like that. That's a breast surgeon. So we would probably refer you to a breast surgeon, or your GP would refer you to a breast surgeon. But you must always worry about a lump in your breast at any time, whether or not you've got implants in. And then last question, I've got a last question here. By the way, I'm just going to give you a fair warning now. You can get live on with me, split screen, if you want. There's a button somewhere apparently that says, do you want to be live? Or do you want to, or I don't know what it says, do you want to join in? So you can join in if you've got a question though. But you can just join in and say, I haven't got a question, because that's not unreasonable. So last question. I should have a banner, shouldn't I? Last question. Polytech. Why do you use Polytech? Someone's just said that to me on this Instagram. They said, why do I use Polytech? So there's different. Polytech is a maker of breast implants, if you don't know. And number one is that there's different types of implants there's different ways you can classify implants, and one way you can classify implants is by the coating of the implant. So that you can have polyurethane foam coating, which is a foam coating, or you can have silicone coating, silicone shell. Well, a polyurethane implant is a silicone implant with a polyurethane coating around the outside. So anyway, the pros and cons of polyurethane implants, something we can talk about at another time maybe. But if you want a polyurethane implant, there's only one company in the world that makes them, and that's Polytech. So if you say, why do I use Polytech? I use Polytech because they're the only company that make polyurethane implants. So if you're going to have a polyurethane implant, you've got to have Polytech. Now, if you're going to have silicone implants, there's loads of companies. Polytech makes silicone implants. Nagor, Allergan recently have not renewed their CE mark, so Allergan no longer. Sebin. There's lots of companies. Mentor, anyway, there's loads. Maybe that's not loads. There's several companies, should I say, who make silicone implants. I haven't got a strong view. When I use silicone implants, I just used some Polytech silicone implants this afternoon, but you can also use you can use any make you want. You might have to, if you come to our clinic, we work at the hospitals. The hospitals might say you can't use a certain make because they can't get it, but as long as the hospitals can get it, I'm pretty comfortable using any make of silicone implants. I think they're all, well, I'll say any, as long as the ones that we've heard of, the big companies. I don't think there's a huge amount to differentiate between them personally. I think people make out that there is, but sometimes you've got to be a bit careful if someone says to you, these are the best implants. I hear that a lot. People say, oh, I've heard that these are the best. Anyone that telling you that one company's the best implants, why would anyone use the others? There isn't a best implant. I think there is pros and cons, and they make out that the texture, yes, the texturing is different, and you can discuss that. Smooth, we can discuss it in terms of ALCL. There's all sorts of controversies and pros and cons with different types of implants. But anytime there's loads of different things, there's no one good one, because if there was one good one, the other ones wouldn't survive in the market. So there is pros and cons of all of them. To be honest, for me, the main difference comes in the warranties. The warranties are different between them. But I think Polytech are a good company, and I'm happy to use I have to use their polyurethane implants. I've been using them for many years. And as I say, used some silicone implants this afternoon. And Nagor is the other company that I tend to use. But if sometimes people come and say, oh, I want Mentor or something like that, and fine, if you want Mentor, you can have Mentor. very good implants, very happy to use those, or another make, happy to use those. So personally, I haven't got a strong view, and I would be careful about anyone who tells you that one is better, because, you know, why would you use the others? So that's it. Anyone want to join in? No? Right, that's it. I'm done with my questions. I'm all out of questions. I think there's been a lot going on. I hope I haven't missed any questions. Oh, God, what about treatments? Oh, we've done that. That's been good. Thank you for that. Thank you for the join earlier on. That was a nice joining. And thank you for all the comments. And yeah, I am going to check myself out of here, because I've got to say it's getting late, and I'm, you know, I'm ready for bed, I tell you. God, yeah. Rock and roll. It's the life I lead. So I'm going to end it. I haven't even done anything with these buttons. I don't know what the buttons is. There's a little aeroplane down there. There's a question mark. There's the faces. I think the faces are like Facebook, are they? Or do they join people? Oh, go live with. Oh, I see. I can make you go live with me. Oh, my God. What have I done? Oh, God. Right. Sorry. I've done something to half my screen. Right. What does that do? Share a photo. Oh, God, look, I can share a photo or video. Wow, this is good. Okay, take a photo. Anyway, good. I'm going to check out. This has been very good, this Instagram Live. I've been very happy with it, and I hope it's been enjoyable for everybody who's been here with me. And have a good evening, and I will find the button. Here we go. End. Good night. Bye. End.